Good afternoon, everyone, and welcome to our virtual health talk. We're excited to be back after our summer break. My name is Melissa, and my pronouns are she, her, and hers. On behalf of the Patient Education and Engagement Program here at the University Health Network, I would like to thank you for attending today's session on dementia. I would like to take a minute to first thank our planning team, the Patient Education and Engagement Program, the Patient Learning and Experience Center, and Education Technology and Media Services. Now, a few words about our online format. This session is being recorded and will be available for viewing with closed captioning at this same YouTube link afterwards. Today, we'll have a presentation for approximately 40 minutes, and then we'll open up to the audience to ask questions for the rest of the session. To submit your questions, we invite you to go to the link on your screen. You can also scan the code using your smartphone's camera or QR code reader app. You can submit questions anytime during the presentation. We want to quickly thank those who have submitted questions already. It helps us see what people are interested in learning about most. We have tried our best to address these within the presentation, but we'll definitely answer them again in the question and answer period. When you submit your questions, you may notice it doesn't get posted right away. This is because we're now reviewing questions before they show up for the audience. This just helps us make sure that questions won't be repeated. It gives us some more time to address new and different questions. It can also help us prepare how to answer the questions before they're posted. We just ask that you please keep a few things in mind before you submit your questions. First, you can choose to include your name or stay anonymous, but please note that others will be able to see your name if you do include it. We ask that you please do not include any personal details about your health or condition in your question. Our health talks are just for general health information only, and the speakers are not here to diagnose or provide treatment recommendations. We'll try our best to answer as many questions as we can during the question and answer period. And lastly, you can also vote for your favorite questions by clicking the thumbs up button. This will help bring questions closer to the top and they'll more likely be answered. If you have any questions about the live stream during the session, you can email us at pfep@uhm.ca or leave a voicemail at 416-603-6290, and a member of our team will get back to you shortly. And just on the topic of technology, we realize anything can happen when it comes to internet connections. So with that said, should my connection cut out at any point, don't worry, keep watching, and one of my amazing colleagues will step in to facilitate the session. And lastly, we would love to hear your feedback about this presentation. Your feedback will help us know what you found helpful, how we can improve our sessions moving forward, and what topics you would like to see in the future. Please go to the link on your screen and complete the survey at the end of the session, or you can scan the code using your smartphone's camera or QR code reader app, and it will take you to the survey. As well, if you fill out a survey, you can now enter for a chance to win a $10 Tim Hortons gift card. So you'll receive a link to enter the draw on the confirmation page of your completed survey. The draw will close on Wednesday, October 6th at 2:00 p.m., so in a week, and we'll draw the name and notify the winner on Thursday, October 7th. We ask that you please make sure to enter your email address correctly, because if you are the winner, that's how we'll notify you, and to also check your spam and junk folders. Now, moving on to our presenters. First, we'll hear from Eleanor Patelli, who is today's caregiver guest speaker. She is 64 years old and a retired employee from the Canada Revenue Agency. She was born in Italy and moved to Canada in 1966. She grew up in Toronto and loves living in the city. She has a husband named Mauro, who she will speak to later on in her presentation, and 3 adult children, Lisa, Erica, and Joseph. Her daughter Erica is getting married in 2 months, super exciting, and she recently welcomed her first grandchild, Mauro, in August. Eleanor enjoys cooking, reading, spending time with her family, and traveling. She tries to get away during the colder months to Florida or Costa Rica whenever possible, and she enjoys spending the summer where she grew up in Italy, connecting with relatives and family members. Then we'll hear from Dr. Carmela Tartaglia, who is a cognitive behavioral neurologist at the UHM Memory Clinic, where she sees patients with neurodegenerative diseases and persistent symptoms of concussion. She is a scientist at the TAN Center for Research in Neurodegenerative Diseases, where she works on biomarker discovery to facilitate early detection of neurodegenerative diseases. The ultimate goal of her research program is to bring the right treatment to the right person. So we have a great group of speakers today. And before we get started, I would like to take a moment to acknowledge the sacred land on which the University Health Network operates. At UHN, we strive to provide safe and inclusive care, and that begins by honoring Indigenous peoples. Indigenous peoples are the original inhabitants of this land, and for thousands of years have cared for this land. In particular, we acknowledge that we're on the traditional territory of many nations, including the Huron-Wendat, the Haudenosaunee, and the Mississaugas of the Credit River. This territory is governed by the Dish with One Spoon Wampum Belt Treaty, an agreement to share, care for, and protect the resources around the Great Lakes in peace and respect. Today, this territory is still the home to many Indigenous peoples from across Turtle Island. We're grateful to have the opportunity to work and learn on this territory. And as you may already know, tomorrow is Orange Shirt Day and the first National Day for Truth and Reconciliation. We encourage you all tomorrow and moving forward to spend some time learning, unlearning, and relearning about the history of Indigenous peoples, to also commemorate and reflect on the tragic history and ongoing legacy of residential schools, and to continue to honor all those affected. If you're not sure where to begin, I invite you to look up what Orange Shirt Day represents and how it began. Now, enough from me. I'd like to turn it over to Eleanor, who will be starting us off.
I was introduced to the University Health Network many years ago, and my family's own healthcare has been primarily through the UHN. This particular experience, my husband's Alzheimer's diagnosis 4 years ago, allowed me to meet Dr. Tartaya, cognitive neurologist, and the rest of the team at the memory clinic affiliated with the UHN. My experience with dementia has been through the perspective of the caregiver. While I'm not the one who was diagnosed with the illness, I see the impacts firsthand daily through my husband's Alzheimer's diagnosis. Through his illness, I witnessed firsthand the cognitive decline that Maurice is experiencing. Short-term memory loss, repetition of questions, confusion about day-to-day tasks, inability to formulate thoughts and sentences efficiently, inability to calculate figures and count money, misplacement of objects throughout the house, like the phone and the keys, etc., forgetfulness with things that he was once familiar with. If there are 2-3 points I would like everyone to remember from my experience, it's the emotions primarily. There are a lot of emotions involved with dementia and Alzheimer's diagnosis. You have to come to terms with the fact that a life you envision for yourself and your partner is going to turn out differently. There are feelings of sadness at times, resentment. It's easy to get frustrated when dealing with a person who is going through a cognitive decline. The repetition gets difficult and it's easy to get agitated. At times, there are also feelings of hope when you can see and remember something like his birthday or a story from days past that he may have otherwise forgotten. Hope through the study and the research that is being conducted on dementia and Alzheimer's. Of course, you can still find moments of happiness. They're essentially the same person, just a different version of themselves. At their core, they're the same person you knew. They still have some of the same qualities they always had. Something that I think is important to keep in mind, and this is something that I am still trying to work on myself, to be honest, is to be patient. Be patient with the person with a diagnosis and the person, and to be patient with yourself. I find with me, I get easily frustrated at times with my husband by the repetition, the inability to complete simple tasks that once came easily to him. Frustrated in general that I now have to be in charge of every aspect of both our lives. It gets tiring, but I try and remind myself as often as I can that he is not trying to make me angry. He is not aware that he is asking me the same thing over and over again. He isn't misplacing household items on purpose to annoy me. It is simply part of his sickness. These are things that come with the territory when living with someone with Alzheimer's disease. And I try and be mindful of that. I do feel guilty at times that I'm not as patient with Maurice as I should be. But at the same time, this is something that is ongoing that I am trying to navigate through myself. What has helped me with the experience has been staying informed about my husband's care and treatment. So far, my husband is part of an ongoing study whereby he gets an infusion of medication once a month, and they do blood work, urine tests, cognitive treatment, and an MRI every 3 months, where he is monitored by Dr. Tartaya and the team, and I receive reports on that study, including the results through each phase. In addition, the team provides me with links in regards to the effectiveness of the drug he is taking as part of his study, and they make an effort to keep me informed throughout each phase. Staying informed about the Alzheimer's study that Maurice is part of has really just allowed me to be more aware of his illness. At this stage of his diagnosis, he is still independent enough that he is able to participate in the study on his own. He can drive himself and go to his appointments by himself, and he doesn't really need me to assist him. But having the information in the case study reports that are provided to me does help me see firsthand the results of the treatment he is receiving, and it gives me hope that this will help to slow down the progression of the illness. It helps me to make decisions about his health care and to stay informed about the treatments he is receiving. Moving forward, I plan to find programs and support groups that Maurice and I can participate in. Ideally, these will be in person, of course, when it is safe for us to get together again. This will give him the opportunity to get out of the house, meet others, and socialize. It is also a chance for me to learn more about his condition, get more tips on how I can support him, hear from other caregivers, and take some time for myself so that I can continue to be strong and healthy to take care of him. Thank you.
Thank you so much, Eleanor, for sharing your experience and tips with us. I'm sure many of us found it inspiring. I know I did when we were working together on this, informative and also reassuring, especially for those who may be going through a very similar experience. So thank you again. So now we'll move on to the rest of our presentation. So next we'll hear from Dr. Tartaglia, who will share her expertise around what is dementia, the different causes of dementia, strategies for slowing down cognitive decline, how to support someone with dementia, and some resources at UHN and in the community. So now over to you, Dr. Tartaglia.
Thank you. Yes, next slide. Thank you so much, Eleanor, for sharing that experience with us. I think, we're all here to learn about, what it is for people who are taking care of patients with dementia, as well as, from dementia patients themselves. So I'm going to talk about what is dementia. Next slide, please. I think the important thing to remember from this talk is really that, dementia is a diagnosis that we make that isn't really as informative as we would like it to be. We diagnose somebody with dementia when we say that their cognitive and behavioral symptoms affect their ability to work, to basically practice what they used to. It shows a decline from somebody's previous level of functioning. It's not because of some short-lived event, so it can't be delirium or related to a psychiatric problem. And it usually involves a memory problem or what we call executive, their ability to manage things, visual spatial problem, language, or personality. So as you can see here, it describes a state, but it doesn't actually tell you what the cause of the state of the problem is. Next slide, please. So I think, the most important message from my talk is really that dementia and Alzheimer's disease are not the same. And oftentimes we confuse the two. Dementia just says that your abilities are different than they used to be, and they're fairly significantly different, so that you are not able to do the things you used to do, and you really need a lot of help. And then we're going to talk about, next slide, please. What dementia actually is an umbrella term that encompasses many different types of diseases. So Alzheimer's disease obviously is one cause of dementia, but Parkinson's disease can cause dementia, frontotemporal dementia. There's primary progressive aphasias, which are just about language problems, cortical basal syndrome, Lewy body disease. There's, vascular disease can cause dementia. There's multiple sclerosis, brain trauma. So you can see that there's many different causes of dementia. And so when somebody says they have dementia, actually, your next question should be, well, what's the cause of their dementia? Because that makes a big difference. Next slide, please. when we talk about the problems that usually we face when somebody is telling us, or we notice in a family member, we're talking about the symptoms that they show. So, when one of the most common ones obviously is, Alzheimer's disease. And in that one, we often talk about the memory problems. So as you've already heard very well, when somebody has a memory problem, they forget names, they misplace objects, they repeat questions, they forget quickly what they've told you, they forget appointments, they can leave the tap on or the stove on. Next slide, please. Those kinds of questions are very different from, let's say, somebody's ability to navigate, right? Sometimes people are getting lost. They have trouble recognizing a familiar face. They have trouble finding objects in they can't find their car. So when people have visual spatial problems, it's a different type of problem. So when you see your doctor, or you bring your loved one to your doctor, you get a lot of questions, and all those questions are really about trying to understand what is the cause of somebody's dementia. Next slide, please. So one of the most common causes that we see is language problems. So people will have trouble finding the person's name or a common word. They have slurred speech, or they don't talk very much anymore, or they forget words. They could substitute words. So we'll ask a lot about how their speech and language has changed. Next slide, please. Do they understand language? Do they understand the words that you're saying? Sometimes people will tell us their memory is bad, but actually it has nothing to do with memory. It has to do with the fact that the person actually doesn't understand what you say. And if you don't understand, it's very difficult to remember. Next slide, please. What about their executive function? Well, you've also heard about this, that people can have trouble planning or organizing. Their judgment can be bad. They can have trouble problem solving. Next slide, please. They can have trouble concentrating. They lose track of thoughts. They have trouble following a TV show, get easily distracted, and all those things will affect their memory. But we need to know whether it's a memory problem or an attentional problem, because those have different diagnoses. Next slide, please. And I think importantly, there can be a change in personality or behavior, and that too can cause dementia. And really, this problem can be in somebody who has great memory. They're able to navigate, they're able to do whatever they used to do before, but their personality or behavior has completely changed, and they can become inappropriate. They can, lose their empathy for other people. They can, become quite apathetic. Next slide, please. They can, change their eating habits. Some people will develop, eating habits where they crave sweets all the time, and they used to be very, health conscious person. They can show motor behavior changes. Next slide, please. So I think it's really important to think about, that, dementia is not only related to a memory problem. Your brain takes care of every aspect of your being. And so when your brain changes, you change. And that means that different abilities become impaired. Next slide, please. Alzheimer's disease is the one, I think most of us are most familiar with, because it is the most common cause of dementia. And, really people think about a memory problem, but Alzheimer's disease can also present with a non-memory problem. So you could present with language problems or visual processing problems or executive problems, but the most common presentation is really this memory problem, where you can't learn things, you have signs of problems that are really, you being able to learn and remember something that you've recently seen. Usually these people's long-term memory is great. They actually sometimes remember things from long ago much better than their peers, but the recent memory is where the problem lies. Next slide, please. And the reason that we see the problems that we see with Alzheimer's disease are really related to these two abnormalities in the brain. One are these amyloid plaques, and the other is the neurofibrillary tangles. And Eleanor was telling us about treatments, and really the current treatments in clinical trials are most of them are aimed at removing the amyloid plaque, but some of them are also aimed at removing this neurofibrillary tangles. And the hope is that if we can get this stuff out of the brain, that we can stop the disease. Next slide, please. Lewy body dementia is actually a completely different cause of dementia, and this is not that uncommon. These are people who will show signs of dementia, but they also have different presentation in their dementia. Is that they will often have fluctuating attention. So these are people where you'll see that at one moment they're really doing well, and next moment they're really, really confused. They can also have visual hallucinations. And then the slowness that looks a little bit like Parkinson's disease, and over time looks a lot like Parkinson's disease. Next slide, please. And of course, you can have Parkinson's disease dementia. Parkinson's is quite common, and many people in the early phases have, mostly a motor problem and very little cognitive change. But over time, people with Parkinson's disease also develop cognitive impairment, and eventually they get Parkinson's disease dementia. Next slide, please. Vascular disease dementia is actually a very common cause. And, many of us think that this is as common as Alzheimer's disease. This is a disease that's caused by really vascular risk factors, which include things like high blood pressure, cholesterol, diabetes, smoking, alcohol, sedentary lifestyle. So these are modifiable risk factors that damage the blood vessels in your brain. And when you damage a blood vessel in your heart, you know about it because you get angina. And that means you get chest pain. But in your brain, it's actually silent. So this is a very silent injury. And eventually you end up with dementia. And so sometimes you don't notice until it's very late. And this is one of the reasons that we're very adamant about being proactive about your brain health. Next slide, please. I think, we focus on dementia, but what we sometimes fail to recognize is that before dementia, there is, symptoms that develop, right? And so the precursor to dementia is really this stage of mild cognitive impairment. And this is when somebody is concerned about their cognitive function, but they are still fairly independent. They, they can't remember as well. They can have some language problems, visual spatial problems, but overall, they're still able to act fairly independently. And so it becomes even more important to think about what the cause is in these patients, because these patients are at earlier stages of disease. And so when you think of when you would want to intervene, this is the stage. But this is also the stage where it's harder to make a diagnosis. Next slide, please. Subjective cognitive decline is actually the first stage, where a person can be concerned about their own cognitive decline, but when we test their impairment, we don't find it. So they can have complaints because they recognize that something has changed, but when we do our neuropsych testing, everything looks fine. And it's important to recognize that these illnesses that we talk about, they start 20 to 30 years before you show any clinical signs. And so, we now recognize that about a third of the people who have subjective cognitive decline do have some abnormalities in the brain. It means 2/3 of the people have something else, but at least 1/3 of them, we are worried that they will develop dementia over time. Next slide, please. So what about dementia in Canada? Next slide. I think Canada, as many other countries, has been privileged in that we are able to allow many people to live to ripe old ages. We have, great healthcare so that we are able to deal with infections. We are able to deal with cancer, very well. And so heart disease, we've actually made great strides in those areas. And so that means we have more and more people living to ripe old ages, which is great. The only problem is that age is the biggest risk factor for dementia. So with the oldest population being the fastest growing population, This means that dementia is a real problem in Canada and will continue to be a big problem if we don't do something about it. Next slide, please. In 2011, there were about 747,000 people living with Alzheimer's or related dementias or some cognitive impairment. It's estimated that this number will rise dramatically over time. And next slide, please. And unfortunately, dementia is a very, very expensive problem. There's a lot of care that is required. There's a lot of medical care, but there's also a lot of non-medical care. And this cost actually does not include all the free labor that goes into the dementia care. So all the caregivers that provide essential treatment and essential services for people with dementia is not included in this cost because they are working for free. Next slide, please. So we really have to think of what strategies can we do to prevent dementia, slow it down. Next slide. So there are methods, there is a lot of evidence that we have some control over our risk of dementia. So we know that there are factors that can lower your risk. One of them is physical activity. So we promote brain health throughout all of your life. And I always say to people, if you don't take care of your house for 80 years, you will be living in a shack. The same applies to our brains and our bodies. We used to have very short lifespans, so it was okay that we didn't take much care of ourselves, but our lifespan is now 85, 86 years old. So that means we have to be very proactive about our brain health. There's a lot of evidence that aerobic exercise, cardio exercise, that means things like stationary bicycle, swimming, dancing, Zumba classes. There's a lot of evidence that that is important for lowering your risk of dementia. As well, education, cognitive stimulation, and this is lifelong. We need to be learning the whole of our lives. What can increase your risk? Unfortunately, diabetes increase your risk, smoking, high blood pressure, depression, obesity. So we really need to take care of these factors. Next slide, please. In 2020, there was a report, a dementia report, that basically identified 12 factors that increase our risk of dementia. And so we're really trying to deal with these factors to try to lower the risk. And there actually is evidence that countries that have been very proactive about modifying our risk factors, that they've actually seen that the rise of dementia has not been to the extent that they would expect, given how many people are living to old age. So things like physical inactivity increases your risk, smoking, excessive alcohol consumption, diabetes. So we really, there's a lot of evidence for this. Hearing impairment, air pollution. Next slide, please. In terms of exercise, I promote this, immensely because we have had evidence for a long time that, in older adults who don't have dementia, exercise can help improve your cognitive function, your functional ability, your mental health, helps cognitive, your thinking, you're able to think faster, helps you remember better, and can delay the risk of developing dementia up to 6 years. Next slide, please. We also have evidence that people with mild cognitive impairment and people with Alzheimer's disease, so you already have the illness, still exercise can be good for keeping the disease going as slowly as possible. So the evidence is really for higher intensity exercise. And so, we really recommend, you have to walk briskly, or you have to cycle, or like I said, dancing, but at least 1 hour a day. And usually I promote 5 to 6 days per week. Next slide, please. Cognitive reserve is this kind of, banking of thinking abilities that we think about. So we used to know that higher education made people less vulnerable to dementia, but we now know that it's not just education, it's lifelong learning. So if you have a challenging job, a complex job, that counts. if you stay socially active, if you are engaged in courses. There's lots of community courses, community center courses, online courses, let's help people learn a new language, instrument, astronomy, gardening. It doesn't matter what it is. This is medicine for your brain. So you should look at it upon like that. And if people take pills every day, unfortunately, we cannot put exercise or learning in a pill form, but they are essential for preserving our brain health. Next slide, please. So what can we do to support people with dementia and their caregivers? Next slide. So, we treat the symptoms that we can. We don't have cures for any of the neurodegenerative diseases that I've spoken about. So we treat the symptoms that can worsen cognition. We know that if somebody has cognitive impairment, and especially if they have dementia, there are things that can make their cognition worse. So things like pain, sleep apnea, low mood. We promote social, cognitive, and physical activities. We know that these things can help people feel better, and so their cognition can be better. Next slide, please. We treat the care partners because we know, as I've mentioned, that they are essential in the treatment of our patients. So, I think Eleanor has alluded to this, that caregiving for people with dementia can be physically and emotionally exhausting. These are US numbers, but I think if you just scale them down to the Canadian population, it's about the same. There's billions of unpaid care hours. And 74% of caregivers in this study said that they actually were really concerned that they could not maintain their own health because of the caregiving burden that they had. And many caregivers suffer from depression. Next slide, please. So we really, promote in the care partners to protect their own health, to watch out for signs of depression, to take charge of their lives, and to acknowledge, where they are, if they need help, use community groups, use support groups as much as possible. And as Eleanor has already mentioned, learning about the person's condition can be really important for, dealing with this, and get support from other caregivers. Next slide, please. So what resources are at UHN? Next slide. So we do have a UHN memory clinic where we see patients who are referred to us from family doctors for different neurodegenerative diseases. We have some caregiver education events, and we have clinical research trials. So these are drug trials. We also have observational studies. So if somebody's not interested in a drug trial, we have research to try to better understand these diseases also. And there's the website. Next slide, please. There's iCare, which stands for Indigenous Cognition and Aging Awareness Research Exchange. And here you can read fact sheets about Alzheimer's disease, signs and symptoms, and what to expect after a diagnosis. It was developed with Indigenous people living with memory loss and their caregivers, and there's the website. Next slide, please. There's the Alzheimer's Society of Canada, as well as all the local Alzheimer's societies, and these provide information and support for people living with all forms of dementia. The societies are available in all Canadian cities, well, not all Canadian cities, but many Canadian cities, and they provide day programs, resources for the patients as well as for the caregivers. Many of the societies also have counselors for the care partners and patients. Next slide. There's the Toronto Dementia Network. This is a source for dementia-related services in Toronto and can tell you about respite care, adult day programs, transportation. It's maintained by the Alzheimer's Society of Toronto. Next slide, please. You still can't find what you're looking for? Next. You can contact UHN patient and family libraries. There's trained health information specialists that can help you find reliable and up-to-date information. And I think, the important word in this sentence is really reliable. We all know there's lots of information out there, and oftentimes I find patients or family members have Googled, the latest therapies and, the latest cure for these diseases. And Oftentimes, those websites are not that reliable. So it's, I think, important to know where to get your information from. Next slide. Thank you all, and I will pass this back to Melissa, and thank you to Eleanor for sharing her experience with us.
Thank you so much, Dr. Tartaglia. Wow, I learned a lot from your session as well, and I know just preparing your presentation too. So let's say on behalf of our participants and the patient education program, thank you. And thank you, Eleanor, for sharing your expertise and experience around dementia. So now we'll check out this Slido to see what questions have been submitted. And for our audience, you can still submit questions if you haven't already. And again, to submit questions, please go to slido.com and enter UHN Health Talk in the event code. But you can also scan that code using your smartphone's camera or QR code reader app, and it'll take you straight to the page. Again, just a few friendly reminders. You can choose to include your name or stay anonymous, but please note that others will be able to see your name if you do include it. We ask that you please do not include any personal details about your health or condition in your question, and that our questions will be reviewed before they're posted just to make sure they're relevant to the topic. I also want to note that we may rephrase some questions to help clarify them for the speakers, but if we haven't covered your question fully, please feel free to email us afterwards and we'll get some more information for you. So it looks like we've gotten quite a few questions. So starting from the top, the first question is there a self-diagnosing tool or questionnaire often acting upon the issue requires some conviction? So I think I'll start with Dr. Tartaglia first to see if you have that.
Yeah, great. That's a great question. I don't know really of a self-diagnosing tool. I mean, you know, there are like memory tests online, but I'm not sure that that's, you know, the best way of making a diagnosis. All of us have different experiences with technology. I think, you know, really when somebody, you know, if somebody has some doubts about their function, and it's a consistent problem. So, you know, everybody's got the one-off where they can't find their car in the parking lot, they've lost their phone, their keys, their sunglasses. That's okay. We're all allowed to do that. You know, the world has become very hectic and people are very, you know, overwhelmed by what's going on. But if something is consistent and then people are starting to tell you that, you know, you're repeating yourself or that things have changed, then I think it becomes something that you want to bring up with your family doctor, the person, you know, the doctor who knows you best. But in terms of self-diagnosis, right now, there's nothing really accurate. And we really think, you know, people are the best judge of themselves. And so we listen to them.
Thank you. And I think that's a great takeaway too. I think everyone, the best person who knows you is you. So definitely that's a great takeaway. Thank you. Okay. So the next question asks, are depression, insomnia, and delusions, such as believing someone is stealing from you, signs of dementia? If they are, what can family members do to help? So maybe we'll start again with Dr. Tartaglia. If Eleanor, you have anything to add for the second question, we'll go to you.
Okay. Yeah, thanks, Melissa. Yeah, so, you know, I think the important thing in those symptoms is, yes, they can be a form of dementia. These are not uncommon symptoms actually in a number of causes of dementia, including Alzheimer's, but also in Lewy body disease, even cortical basal. I'd say depression is very common across all the neurodegenerative diseases. Insomnia, again, very, very common. But the important aspect of this question, I think, is really to think about, are there other things this could be? And so if this is going on, this needs to be brought to somebody's attention, because I'll tell you that people who are depressed can also have insomnia and delusions. And so in those people, if you treated the depression, you could actually improve the insomnia and the delusion. And this is not a neurodegenerative disease. I always tell people, it's like when you have a cognitive problem or you have a change in personality or you have, you know, your brain takes care of everything that you are. And if your brain changes in any way, or we're going to see the change on the outside. But that doesn't tell us what the cause of the change is. And that's what, we expend a lot of energy now trying to think about is how are we going to diagnose the cause? And so people don't walk in with a label. They walk in with symptoms. They walk in with things about themselves that have changed, that they are, they're depressed, or they can no longer sleep, or they're seeing things, or they're always angry, or, those changes reflect the brain function, but they don't tell us anything about the cause of that change. And so it's really important to think about that. And so, yes, this could be a sign of dementia, of a neurodegenerative disease causing a dementia, but it could also be a sign of something else.
Thanks, Dr. Tartaglia. So I'd say to speak to the person's doctor for sure for more information. Okay, so the next question asks, is dementia hereditary? So that means, can it be passed down from a parent to a child?
Yes, so some dementias are hereditary and some are less hereditary. So hereditary, usually when we think about it in our kind of day-to-day lives, we think of a gene. So having a bad gene that you can pass on to your children. And in Alzheimer's disease, that actually is quite rare, that one bad gene in you would be passed on to your children, or if your parents had it. But in frontotemporal dementia, actually, it's not uncommon. So 30 to 40% of patients with frontotemporal dementia actually do have a genetic abnormality, and that can be passed on to their children. So that's why it's very important to know what the cause of somebody's dementia is. Now, that's at the one gene problem. So those are the genetic diseases that we often think about. But when we are now starting